Hey, chances are if you're watching this video, you're dealing with or have dealt with that pesky little eye twitch. In this video, I'm going to talk about how you get it and how you get rid of it. Stay towards the end of the video because I'm going to tell you what home remedy I used to get rid of mine. Let's focus in. Hey, howdy everybody, I'm Dr. Neil Guymon, Dr. EyeGuy, the show that focuses on keeping your eyes the healthiest and your vision the clearest. Consider subscribing, also check below for any additional links. Now let's focus on that eye twitch. Now the term for eyelid twitching has a crazy name called myokymia. Myokymia is actually very common and harmless, it's just stinking annoying. The most common presentation that people usually get is usually on one eye, unilateral, and it's usually fluttering on the bottom eyelid, can also happen on the top eyelid, and it's a small involuntary muscle flutter, usually of the orbicularis oculi muscle, and that's what causes that eye to kind of move and twitch, is that muscle is just involuntary contracting. Now, if you're lucky, this usually resolves itself, usually within hours, sometimes days. If you're unlucky, it can extend out to weeks and sometimes months, just constantly being there, fluttering there all day, constantly a reminder, hey, tick, 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 bam, 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 hey, it'll drive you crazy. The spasm of the muscle usually occurs on that bottom eyelid, like I said before, and it's usually on the outer corner. And what is tricky is the patient, the person that's actually having this eyelid twitch, will see it very well because it actually moves their eye a little bit and actually bumps around their vision, and that's what's so annoying about it. In fact, you'll get a patient or you'll get someone that has the eyelid twitch and they'll come up, hey, do you see my eyelid twitching? And you'll look very closely at the eyelid, and sometimes you can't even tell it's twitching, but that person can tell because it's actually moving their eyeball and causing that little jumpiness in their vision. So just to add on to the extra annoying factor of the eyelid twitch. Now there is a different type of eyelid twitch, usually bilateral on both eyes, involving both eyelids. And that contraction can be so strong that it will close the patient's eyelids involuntarily to the point where they can't open them sometimes. Now, if you're having this type of presentation where both of your eyelids are closing with that muscle spasm, then you want to go in and see your eye doctor. A little bit different condition and a little bit more involved. Now, what causes this eyelid twitch, myokymia? To be honest, the exact cause is not well understood. Not really sure exactly what causes it, but it is associated with a few things. It's associated with increased stress, increased caffeine intake, lack of sleep, sometimes vitamin deficiency. Pretty much your daily workday, family life will cause an eyelid twitch. Super annoying. And sometimes I feel bad about that because sometimes I get people into the clinic and that's their main complaint, is they've had this eyelid twitch for weeks, months, and they can't get rid of it. They don't know what to do. And then here I come saying, well, hey, maybe if you just reduce your stress, decrease caffeine, maybe get some more sleep, then it will go away. It actually feels weird. It almost feels like I'm brushing patients off when I tell them that. When the prescribed treatment is, hey, just go Netflix and chill, and then hopefully your eyelid twitch is gonna go away. I don't know, it just doesn't really come off as, hey, this guy's an eye doctor, this guy knows what he's talking about. But that's the main treatment, is to avoid these triggers that can cause this eyelid twitch. So yeah, annoying for the patient, also annoying for the doctor to tell them what to do about the eyelid twitch. Now there's some other things you can do that help people get rid of their eyelid twitch. One thing, while your eyelid is currently twitching, you can get a warm rag or a warm compress or ice bag and actually apply it to your eyelid to see if you can calm it down that way. Also, sometimes eyelid twitches are associated with eyelid allergies or itchy eyes, and if you can get your hands on some allergy eye drops, sometimes that also helps or decreases the eyelid twitching as well. If you're one of those unlucky people that have had this eyelid twitch for weeks, months, chances are you've been on the internet trying to look at eye forums of where these people with eyelid twitches have used a home remedy and what's worked for them. Now, because you stayed to the end of the video, I can tell you what home remedy I used to get rid of my eyelid twitch. I was one of those unlucky ones where I had an eyelid twitch, I swear, for months. I started a new job up in Washington, and every day, chronically, I'd have an eyelid twitch. In fact, I was almost getting self-conscious about it because as I was seeing patients, the eyelid twitch would happen and I could see it bouncing in my vision. I doubt the patient saw it, but in my mind, I was thinking, oh my gosh, this patient sees my eyelid twitching and I must look like a crazy eye doctor and they weren't gonna trust me. It got very annoying. Now, one of the most common home remedies you'll find out there on the internet, and it's actually what I use to get rid of my eyelid twitch, is the use of quinine. Now, quinine can actually be found in, tonic water. One of the most common uses of quinine is actually in nocturnal leg cramps. It's been shown to reduce these leg cramps. So some of these people that have these cramps will take quinine supplements to reduce them. Now, I actually get nervous about telling patients about quinine because I have this fear they're gonna go home, get their hands on some quinine supplements and just keep popping quinine pills to try and get rid of their eyelid twitch. But don't do that because you can actually overdose on quinine. An increased amount of quinine can actually cause some serious problems. So don't be overdosing on quinine, or if you're at least thinking about taking quinine supplements, discuss it with your primary care doctor first to make sure that you're not at risk for any serious problems from this. Now, getting your quinine from tonic water isn't going to put you in that overdosage mark, so I feel pretty comfortable telling patients to drink tonic water. I usually tell them to drink maybe 1 or 2 glasses a day for a few days to see if that will get rid of their eyelid twitch. Now, again, this is a home remedy. It may not work for everybody. It did work for me. Now, that being said, it could have been just a coincidence, meaning that my eyelid twitch was about to stop at that point anyway. But I did drink the tonic water, I think for 2 days, and then my eyelid twitch was done. So if I get an eyelid twitch that's that chronic for that long again, I'm gonna be drinking some tonic water for sure. Now, if you've never had tonic water by itself, it's nasty, it's dag nasty. I'm actually gonna drink a cup. I don't have an eyelid twitch, but I just wanna be reminded of how bad it tastes. Because if it tastes really bad, then I'm not gonna put this video up because I'll feel bad telling people to get tonic water and they go drink tonic water and then they barf everywhere. It's probably good just to get the taste. I don't think I'll drink all that. Bottoms up, cheers, goodbye, eyelid twitch. Ugh. That's worse than I remember. Ooh, that's bad. So you might want to mix this with a different drink. I don't know, put some Sprite in there, but ugh. You'll have to decide. You'll have to decide for yourselves if you want to drink that. But yeah, usually if the eyelid twitch is going on that long, then yeah, you're desperate to get rid of it. But yeah, so try it out. I drank, I think, 2 cups a day for a couple days and my eyelid twitch was gone. So it worked for me. Doesn't work for everybody. Worth a shot. Really cheap at the grocery store to get. But man, that taste is staying in my mouth. I'm gonna have to go eat a cookie or something. Woo. Be sure to like the video after drinking that tonic water. Hey, thanks for watching the video, everybody. Be sure to share this video. This is one of the most common questions and complaints I get in the clinic, also from friends and family, is what to do about this eyelid twitch. So please share the video, spread the word of what it is and what they can do about it. Question for the comments today is, have you ever had myokymia, and what did you do to get rid of it? Again, I'm Dr. Neil Guymon, Dr. EyeGuy, looking out for you and your eyes. Stay focused, and we'll see you in the next one.